To get started here, just curious, what is an opioid steward or a steward of opioids? I heard you both mention that in your introductions.
That's a really good question, Ben. So the way that I like to think about opioid stewardship is think about whether or not we are using the opioid wisely and appropriately, right? Because in a lot of cases, just because we see that an opioid is being prescribed, I always have to ask myself and my trainees that are we using it appropriately? Meaning that is the indication correct? Is the duration appropriate? I mean, there is a lot of gray area involved, right? No doubt that there's a lot of gray area involved when it comes to opioid prescribing. But then when we think more about the appropriateness, for example, does the patient have any kind of underlying psychiatric conditions that we need to be concerned that maybe we need to dose it a little bit more wisely and appropriately? And those are the cases where a pharmacist, especially like a pain specialist, can really have a big role. And that is really how I think about opioid stewardship.
Yes, and I would agree with Ping. It's very synonymous with antibiotic stewardship. So some people are well aware of, using the right antibiotic for the right bacteria for the right amount of time. So it's the same thing for opioid stewardship, which does not mean that nobody should get opioids, and that's maybe a misconception. There is still appropriate use of the higher risk opioids. So we help with those decisions, evaluating risk, like Ping said, with mental health background, maybe respiratory conditions that might contribute to a potential respiratory event. And it's across settings. So it can be inpatient, like Ping is mainly inpatient with opioid stewardship. I've been involved in both inpatient and outpatient, but not everybody may be able to do that wide of a stretch.
Appreciate that explanation. I think it's a common misconception that being an opioid steward or a steward of opioid prescribing means that you're attempting to slash or cut out opioids at all cost when it sounds like it's more of making sure that you're prescribing responsibly and doing all the things that you can to prevent overuse or misuse of controlled substances.